Welcome to ADAPT NCLEX. Cardiology can make or break the NCLEX. This is your ultimate cardiology workup. 85 high-yield questions. If you can go through this, you can pass the NCLEX. I'm going to build your stamina. We're going to use select or apply, the prioritization to know what are the symptoms and how to use symptoms to make a diagnosis. By the end of this video, you'll be comfortable to answer cardiology questions and case study. Let's get to it. First question. These questions are prioritization questions, and I want you to be comfortable. There's an easy way to approach them. As you've watched all my video, you have to divide a question into two and ask yourself, is this a B-sharp moment or unexpected finding? Therefore, how do we approach this? Straightforward, like I've said. These are our cardiology situation. 65, age does not matter. Aortic stenosis, what should I expect? Syncope on exertion, is that what I should expect? Is this problem worrisome? Is it part of the B-sharp? We have a patient, stable angina, report chest discomfort on climbing the stairs. Is that something you should worry about? We have a peripheral artery, disease, PAD, who reports severe pain and power when the leg is elevated. Is that unexpected finding or B-sharp moment? Do we have hypertension patient who report occasional dizziness? And then you write your B-sharp and you said what? Is any breathing, electrolyte shock, sepsis, airway, and pain, and that I should worry about? Oh, if you have hypertension, occasional dizziness is bad, but that's not the priority. PAD, if you elevate your leg, it's going to hurt. And your leg is going to look power, like white. Don't worry about it. Unexpected finding. You have stable angina. Well, you're going to have chest pain. And when do you get chest pain? When you are exerting yourself, climbing the stairs. Unexpected finding. Therefore, we have only this. Aortic stenosis with the syncope is a warning sign for sudden cardiac arrest. This is how you do prioritization. Therefore, we're going to go with number one. All the questions are cardiology, and we'll be going through simple prioritization. Then I will give you information where you have to make a diagnosis based on the clue that I'm going to give you. I call them buzzword. So let's get to it. First question down. Second question, same thing, prioritization. Which client should the nurse prioritize for additional workup? We got to do something. That means you got to be sharp and pay attention who is in trouble. The nurse assessing several clients at outpatient cardiology clinic. Once again, divide the thing into two. Find the cause. What is the problem? All the patients are on amiodarone, as you can see. Therefore, I'm not worried about it. I just have to pay attention. What is the major side effect of amiodarone? The patient taking amiodarone, it develops what? Blue-gray discoloration. Amiodarone, cold intolerance. Amiodarone, clay-colored stool, right? Amiodarone, report dry, productive cough. Oh, then I write my amiodarone. I said P-clone. That is the buzzword. When you see amiodarone, write P-clone. That means P isn't your number one. Pulmonary fibrosis. You're going to have cardiac issue, right? You're going to have liver issue. That's why you have clay-colored stool. You're going to have endocrine. That's why you have cold intolerance, right? You're going to have dermatitis. That's why you have blue-gray discoloration. But what is the problem? If I see pulmonary fibrosis, I'm going to make you another baby, or I'm going to recreate you, and that's clone you. Therefore, this patient who is having dry cough is a bad problem. That's your prioritization. And this is assessing for client at the cardiology clinic, taking what? Nitroglycerin tab for stable angina. Once again, every question, I will give you concept and take the concept with you to answer the question. What is the concept for nitroglycerin? There's a key thing you're supposed to do with nitroglycerin. Look at the question and see, and the answers, and see if the patient is following through. A 65-year-old who patient sit down and take the tablet at first sign of chest pain. Is that what you do? You teach the patient? That's the concept when they're taking nitroglycerin. A 58-year-old places the tablet under the tongue, sublingual, every 5 minutes, right? Up to what? 3 doses as needed. Is that what you do? That's the way you should teach the patient. 70-year-old, he swallowed the tablet with water when he has chest pain. Should you intervene? You keep the tablet in the original dark container. These 4 concepts is what you need for your NCLEX, and I want you to write it down. Every time they give you nitroglyceride, these 4 things may show up. There's one more about when to call the emergency room guy. When you have chest pain, you take 1 tablet. If it doesn't go away, call before you even proceed to take the second one. Therefore, what is the problem? This guy is doing writing. You take the tablet, first sign of chest pain. It's a sublingual. You put it under the tongue. You can repeat it every 5 minutes. You should know, swallow it. It's a sublingual, no water. And you should keep it in original container because it's dark. Write all these concepts down because that's what you should expect with nitroglyceride. This is our prioritization. What is the next priority action? That's the first thing you read. I'm paying attention. A nurse is caring for a client with pulmonary embolism on IV heparin. Oh, platelet count is what? 90,000. What should I do? Prioritization. Something should tell you. Decrease the heparin, change IV heparin to enoxaparin, hold the IV heparin for 90 minutes, or anticipate prescription for rovaroxaban. Bring your content. You said, oh, patient has what? Breakdown. Look for the buzzword. This is what I'm saying. Pulmonary embolism, IV heparin, platelet is going down. Connect these 3 dots. This and that, platelet down. If I give you heparin, your platelet go down. It's called heparin-induced thrombocytopenia. What is the concept? Write it down. Every time you see heparin-induced thrombocytopenia, you are not going to give the patient any more heparin. I don't care if you decrease it. I don't care if you hold it. There is no more heparin. That's the concept to answer the question. If you look at the answer, I see heparin. I cancel it. I see heparin. I cancel it. Another heparin. I cancel it. There is no heparin. I'm picking you. That is the concept to answer the question. You don't even have to think. Heparin, low platelet, no more heparin. I don't even care about the sentence I've written because it's a trap. If you follow it, you get in trap. Pay attention to the concept and write it down. Therefore, we're going to give you anything that does not have heparin in it. And that's the medication. And that's the explanation. Number 5, concept, prioritization. If you need it, I need you to click on the button right now and subscribe to ADAPT NCLEX. You get more content with prioritization. This is cardiology prioritization. And nurse is caring for 4 clients who has what? Abdominal aortic aneurysm. Which client should the nurse prioritize for additional problem? They all have abdominal aortic aneurysm. Therefore, you're looking for bad things that will happen to aneurysm. What is that? Rupture. Which signs indicate rupture? Blood pressure of 140/85, but he has mild back pain. What do you think? Pulsating abdominal mass. Is he worse than the first one? He has occasional frank discomfort, and he has severe calf tenderness when walking. What do you think? Don't get trapped. Pay attention. I said be sharp. Shock, sepsis, airway. For this patient, I'm worried about shock. Blood pressure is normal. Back pain, I don't like it, but blood pressure is still normal. You are not in shock. Positive abdominal mass, you're going to rupture very shortly. Occasional discomfort, I may pair it with mild back pain. Severe calf tenderness, you having claudication because you have peripheral aneurysm. Therefore, what do you think? Classic prioritization. Positive mass in a patient with AAA, that's a problem. It's going to rupture. Who should the nurse see first? Same thing. Prioritization 101. Break it down. Look for unexpected finding, and cardiology prioritization require you to know the content, and you take the buzzword. I will show you. We'll get to some. The next kind of questions will be buzzword questions where you connect the cues to find the diagnosis. And that's what recently somebody told me they asking on the exams. So know how to find cues Put it together. What is the problem? They all 1 hour. What? Cardiac catheterization. What am I worried about? Bleeding. He went through the femoral area and there's bruising in the groin. Is this bleeding? 1 hour, what? Post large paracentesis. They draw fluid from the abdomen. I'm going to worry about hypotension. He has headache and temperature. Well, that's not going to kill them. 1 hour after post-liver biopsy, I'm worried about bleeding. His heart rate is 75. It's okay. 1 hour post-admission for pneumonia, I'm worried about sepsis, but he's getting antibiotic. And his temperature is not that high. SAT is fine, roommate. Therefore, you know he's in trouble. Number one, he's in shock. He's going to die from bleeding. We got to see him. Did you see how I'm approaching prioritization? That's the way I want you to do that. 6 questions. The next one, select or apply heavy. Select or apply heavy. I want you to be comfortable. By the time you finish this video, you'll be comfortable answering select or apply. And I'm going to give you signs and symptoms. How do you connect signs and symptoms to diagnosis? Client with what? Left-sided heart failure. What is that? Left-sided heart failure with what? Progressive dyspnea. Which clinical manifestation will happen? What do you think? All I'm asking you, what should you expect in a left-sided heart failure? And then you write it down. You said left side heart failure, you're going to get lung symptoms. That's all. Pulmonary symptoms. To know the detail about cardiology about this, I have a video that I did. I will attach to this. It will give you the content. But the only one thing you should know, left-sided heart failure should be about your lung. Therefore, if you pick in an answer, pick it about the lung. Bracos is about the lung. Okay? Dyspnea on exertion is about the lung. JVD is the system, not your lung. Orthopnea is your lung. Ascites is not your lung. That's all. Trust me, that is the way. Make the answer choice selection easy. Don't overthink it. Don't overthink any of these questions. Next one. A client with acute pericarditis. What should you expect? I want you to write this down. If you're having problem with the concept, I use this strategy to create these videos, to create these questions. I take pericarditis, and these are signs and symptoms you should know. This will help you with what? Case study, select or apply, everything. Pericarditis, that means the pericardium of the heart is inflamed. You have inflammation there. There's key words that you need to know about this diagnosis. What is that? Do you have chest pain worse when you are supine position? Does the chest pain get worse when you lean forward? Do you have diffuse ST elevation? Is your pulses going to be bounding? And do you have hypotension? These are signs and symptoms. If you know this, case study will be easy. If you know this, select or apply will be easy. If you know it, prioritization will be easy. What should you expect? Well, when you have pericarditis, there's inflammation around the heart. When you lay flat, it's going to hurt. When you lean forward, it gets better. So this is wrong. Your ST elevation, because you have chest pain, is going to be elevated. But what is it? Diffuse ST elevation. It does not affect your pulses. Your pulses is not going to be bounding. And you're not going to be what? Hypotensive, unless you have severe what? Constrictive pericarditis, and you've developed what? Tamponade. And so these are signs and symptoms this patient will expect. The nurse will expect to see. I want you to master this, and you have to watch this video multiple times to know about this problem. Unless the patient develops tamponade, they're not going to be hypotensive, their pulses is not going to be affected. Number 9, same thing, pericardial effusion. What do you know about it? A client with recent pericardial effusion is being assessed for what? Tamponade, cardiac tamponade. This is a classic way you will see the NCLEX ask the question. Try to frame it like the way it is. Cardiac tamponade. The key word is not pericardial effusion, it's cardiac tamponade. Patient has pericardial effusion, that means fluid around the what they had. Now they have cardiac tamponade. There is signs and symptoms of cardiac tamponade, and you should know. If I'm squeezing your heart, what is going to happen to you? Your heart sound will decrease, muffled heart sound. You're going to have congestive heart failure, and you develop JVD. Your blood pressure is not going to go high. It will decrease. What will happen? Your blood pressure will get closer. Systolic will get closer to what? Diastolic blood pressure. That is narrow pulse pressure. You're going to be what? Tachycardic. Write all these signs and symptoms down. You're going to have narrow pulse pressure. It's an acceptable finding. You're going to have muffled heart sound. If you don't know about tamponade, write this down. You're going to have congestion. You have JVD. Your blood pressure is going to go down, and you become tachycardic. Signs and symptoms. This is what the person said. They asking signs and symptoms connected to diagnosis. Now you know what are the signs and symptoms of cardiac tamponade. That's the key. Same thing. A client with what? Atrial fibrillation with what? Rapid ventricular response is being assessed. Which clinical finding are anticipated? Look at it. This is a hard one of the hardest one. But don't worry, it's a selected apply. Let's break down the question. You can stop the video, try to answer it yourself, and then put your answer in the comment. But this is the way you should approach this hard question. Selected apply. What you should do, don't over-select. Don't be greedy. Pick those that you're confident. Which finding are anticipated? That means the one I will see. Look at the way I approach it. Patient has what? Atrial fibrillation. There's one word there. That's the bars rate. Atrial fibrillation. And he has rapid ventricular response. The atrial is fibrillating. The ventricle is also responding. Which finding are consistent? Number one, if you have atrial fibrillation, your rhythm is irregular. You don't have to overthink it. If your rhythm is irregular, if you look at the EKG, it looks like this. I can't even see a P wave, loss of P wave. Well, if your heart is fibrillating, you can form clot, risk of stroke. Unless you have a chest pain, you're not going to have elevated troponin. And there's going to be pulse difference. Your systolic, the pulse difference deficit, right? Pulse deficit means if I look at your apical pulse, I check apical pulse in your chest, and I check your regular pulse, there's going to be different. That is what we call pulse deficit. Therefore, we have irregular rhythm, loss of P, risk of stroke, and that. That's all you need to know for this question. Very, very classic. Number 11. Same thing. We're looking at signs and diagnosis to find out signs and symptoms. A client with what? Right-sided heart failure is being evaluated in the clinic. Which findings should the nurse anticipate? Selected apply. We dealt with what? Left-sided heart failure, and we saw what happened. Left, you look for the lung. If it's right, you look for system. Therefore, which of those is a systemic manifestation? You're going to have edema. Blood is going to pour back up. Blood is going to back up. Blood is going to back up. You're going to have JVD. Blood is back up. Your liver is going to get bigger. Blood is back up. Pink fluid. That is your lung. Weight. That is the general system. These are signs and symptoms of right-sided heart failure. How are you doing so far? Number 11. I know you get 11 out of 11, but you can see what I'm doing. I'm trying to give you diagnosis, find the signs and symptoms. These, you connect them together. Every time you hear right-sided heart failure, this should pop in your head. The client is taking calcium channel blocker. It's being evaluated during what? Routine visit. Which effect should the nurse expect? Same thing. What is the concept? Write it down. Stop the video. Think about it. This is your leg. This is your leg. Calcium channel blocker, what did they do? They make your vein bigger. So your vein become bigger. And what does it do? You pull blood into your leg. When there's more blood, what is going to happen? You get edema there, right? You become hypotensive because it does not go into your heart. That is the problem. And therefore, peripheral edema is an expected finding. What does calcium, too much calcium does? It causes constipation, not diarrhea. You see what it's going to do? Too much calcium causes constipation. What is the problem? If I pull all the blood in my leg, my blood pressure decreases. I'm not going to be tachycardic because I'm going to block the heart and slow them down. This will be bradycardia. It does not affect your what? Your lung function. And therefore, I should expect peripheral edema and decreased blood pressure. These are signs and symptoms of excessive calcium channel blockage. Number 13, a nurse is caring for a client with what? Now we're on pharmacology. We've moved to pharmacology. These are high-yield cardiac pharmacology. A nurse is caring for a client with ischemic stroke receiving what? Tenecteplase. Which action should the nurse prioritize? Monitor urine output, monitor for bleeding, monitor for neurological changes, monitor for heart rate. I need you to stop the video, please, and then try to answer this question. There's a buzzword you need to recognize right away. And if you do that, this question will be easy for you. Which one should you prioritize? Look at it. First thing, go back to the question, read it from the back, and figure out what is being asked. Prioritization. Patient has stroke, and he's taking Tenecteplase. This is what? Thrombolytic therapy. Why? Probably is ischemic stroke, and we're trying to break the clot. Should you monitor for urine output, bleeding, neurological changes, or heart rate? The major complication for this medication is bleeding. But how do you manage for bleeding when you have stroke? You're not looking for bleeding from the GI tract or anywhere. You're looking for bleeding from the brain. How does it manifest? Acute change in neural status. This is a critical thinking question. It has nothing to do with the bleeding outside. This bleeding will be in your brain. When you're bleeding in your brain, you're going to have acute neurological change. Therefore, anybody receiving Tenecteplase, which is an antiplase for stroke, you should worry about neurological change. That is your earliest sign of bleeding. Now, I changed the question. I give you the same thing. I want you to learn. I'm trying to help you guys learn critical thinking. Same question, different scenario. And these two questions, I want you to tag them, come back to them, 13 and 14, so that you can know how to answer questions. A client with what? An acute MI, this one is heart attack, is receiving Tenecteplase, the same medication. Which assessment should the nurse prioritize? Worry about bleeding, monitor for acute change in mental status, monitor heart rate trend, and monitor urine output. It's different when we're dealing with heart attack, but it's not different. It's MI, same medication. What is the major side of this medication? Bleeding. But since I'm not going to worry about your heart, I'm going to worry about bleeding. But bleeding where? Outside your heart. That is the key. But not your brain, because the stroke, we are not dealing with the stroke situation. That is the difference. Now we stick with the bleeding, but the earlier signs of bleeding in this situation, not where the clot is in your brain. There's no clot in your brain. I worry about bleeding. So major bleeding is the right answer. Even though the other one, we pick neurological problem, this one is not your brain that we are fixing. We are fixing your heart. Therefore, major bleeding is the major situation you should worry about. These two questions, come back to them. Are you intimidated by this? You know the answer. Pharmacology. Which of the following clients should the nurse question? Right, the prescription. Why? The nurse is reviewing prescription for several clients. They're on Lisinopril. Well, if I need to question, I need to figure out the side effect of Lisinopril. And I write A's. What is that? Angioedema, cough, electrolyte issue, teratogenic. Well, if you're pregnant, I'm worried about you. If your kidney is not working, I'm worried about it. Your blood pressure is high. That's why I give you Lisinopril. I'm not worried about it. Salt substitute means you increasing your potassium. Well, Lisinopril increases your potassium. I'm worried about you. Aliskiren, this also increases renin, is related to renin, increases your potassium. I'm worried about it. Trimethoprim is potassium sparing. I'm worried about you. You see, long question, select and apply. You don't over-select. If you don't know it, please leave it. Pick those that you are 100% confident and move on. Therefore, pregnant problem, creatinine increase problem, salt substitute, too much potassium, aliskiren, too much potassium, trimethoprim, too much potassium. This patient, we got to intervene. How are you doing so far? 15 questions. What is your score? I would like you to put it in the comment. You can stop the video, come back, but I want you to go through, master this stamina, 85 IU questions. We're going through what? Pharmacology. After that, we'll get to what? EKG. And trust me, I'm going to take you up and down, up and down. We'll come back to prioritization. We'll come back to signs and symptoms. You will never forget if you finish this video. A nurse is caring for a client with the following vitals recorded. Look at the blood pressure, too high, 220 over 110. What is the heart rate? 120. Which of the following medication should the nurse anticipate from the healthcare provider? Lisinopril, losartan, Esmolol, spironolactone. Once again, stop the video. How do you benefit from this? Stop the video, answer the question the way you want, and then use the strategy and see the way I'm approaching it. Blood pressure is too high, and what? Tachycardic. That means I got to address both problems. Lisinopril does not affect your heart rate. Losartan does not affect your heart rate. Esmolol, it has a law. It's a beta blocker. It will help with your heart rate and blood pressure. Spironolactone, it's just fluid. It may make you tachycardic. Esmolol, right answer. You see the way I approach it? I know you master it. Let's keep on going. Number 17. What do you think? EKG. We are on the EKG. If you are afraid of EKG, I want you to stop the video. Take a deep breath, find some water to drink, and come back. And then see the way I'm going to approach you. You will never be afraid anymore. They are clinical questions. First, recognize it and see what the question is asking you. That's all. A nurse is caring for a client with the EKG strip. Which prescription should the nurse anticipate from it? That means, what am I going to give you? Adenosine, epinephrine, atropine, amiodarone. Then you said, okay, these are our cardiac medication. And I see this. First thing you see EKG, see if the RR interval are normal. That means from here to here, are they normal? Is it the same? You can see the length are not the same. The RR interval are not the same. From here to here to here to here are not the same. As soon as I see that, is what? Either a block, B block, or Afib. There is no block sign there. The QRS complex are the same. Therefore, I'm not going to worry about it. This is what? Afib. If it's Afib, I need to slow you down. Which of this will slow you down? Adenosine is for what? SVT, classic. You don't use it for Afib unless there's nothing left. But this is not the best choice. Epinephrine is going to speed your heart up. Patient has Afib, is going to go up. Atropine will increase your heart rate. I don't need that. I need to block you and convert you back. Amiodarone is the right answer. Antiarrhythmic medication. That's the way you answer that question. Same thing. A nurse is caring for a client in an emergency room with the reading below on the cardiac monitor. We're doing ECG, EKG, interpretation, and nursing intervention. Client blood pressure is what? 130 over 70. Which action should the nurse prioritize first? Prescription for adenosine, bilateral cardiac massage, ask the client to bed down, immediate synchronized cardioversion. Stop the video, go back again, and say, hey, why do I give you blood pressure for a patient whose rhythm is that? What is this? I give you blood pressure for that. That means blood pressure is normal, and he has this. I see the QRS complex, they are uniform, and I see the P and the T all buried together. There's no difference between the T and the P. This is SVT. You're going too fast. Therefore, what would I do? First, I got to know blood pressure is normal, so the patient is not getting sick. Therefore, I don't need to do synchronized cardioversion. Patient is asymptomatic. I don't need to give them adenosine either. The first thing I can do is let them bear down. Vagal maneuver. If it doesn't help, then you can give them adenosine. You see, everything is normal. Cardiac massage is going to cure them bilaterally. So bear down. Same thing. A nurse is assisting the core team on the cardiac ward. Client is unresponsive, number one. Pulseless, number two. That means he's dead. Which intervention should the nurse prepare for based on the ECG tracing? That means what will you give the patient? Unresponsive and pulseless is not doing anything. But what is the EKG shows? Flat line. This is asystole. And do you manage asystole, defibrillation, synchronized cardioversion, atropine, or epinephrine? I would like you to put the answer in the comments and let me know. Let me know what will be your answer for this question. Patient is as asystole, is unresponsive, is pulseless. Will you defibrillate the patient, synchronize cardioversion, atropine, or epinephrine? This is not shockable rhythm. Therefore, CPR followed by medication. What kind of medication? Something that will jumpstart your heart. Epinephrine is the right answer. This is a critical way of answering ECG interpretation question. This is the way it's supposed to be done. A nurse is caring for a client with diagnosis based on the ECT below. What is the problem? Which of the following assessment findings need immediate follow-up by the nurse? Patient has this. You're caring for this patient with this rhythm. Same thing. Look at it. These two, that the QRS complex are not the same interval. The RR interval is not the same. This is classic Afib. Afib is one of the rhythm issue, like you should take a picture in your head and you see it, you say, this rhythm is not regular. As soon as you see it, you know what it is. This is irregular. If you have Afib, which condition should I worry about? This is EKG prioritization. Immediately, irregular pulse, 100 to 115. Patient has abdominal pain. He has palpitation. He has mild nausea. This is prioritization, risk reduction question. Please put down your comment. Answer this question. I really want to check. I will check for question 20. Who is going to answer it? How many people get it right? And I'll reply to you. But I want to know, what will you pick for this particular question? 20. And I said, be sharp and not expected. That's what I said. Be sharp. If you have Afib, based on that, you're going to have irregular pulse. If I see abdominal pain, don't worry about it. You may have a clot, embolism, go into your brain, your leg, your abdomen. That's what has happened. You're going to have palpitation. That's the definition of Afib. You may have mild nausea, but abdominal pain means you have ischemia, you have clot. This is a bad problem. This is a hard question, critical thinking, and that's the ADAPT NCLEX way. NCLEX practice question, cardiology for nursing student, cardiology for RN student. This is for you. And this is caring for a client with what? Ventricular tachycardia, who is unresponsive and pulseless. Buzzword. Which intervention should the nurse initiate immediately? Look at the way I answer questions. I try to find the key word. I want you to do that. If you do that, the answer choice will pop out like a candy. Immediately, you are VTAC, you are unresponsive and pulseless. Synchronized cardioversion. I give you amiodarone and immediate cardioversion. CPR and prepare for defibrillation. I'll give you amiodarone. What do you think is going on? VTAC and no pulse is called VFib. How do you manage VFib? Defibrillation. That's all. Anything that has defibrillation, I'm picking it. You may not have the Defibrillator right away. So you initiate CPR quickly, then boom, you defibrillate them. You don't need to cardiovert them. You don't need to cardiovert them. Amiodarone alone is not going to help. Patient is in trouble. It's in VFib. Jumpstart the heart. This is the answer choice you give it. This is a classic EKG interpretation. Number 22. I know you know this. I know you're mastering it. Stop the video, the same thing. Look at the way I'm going through. Which medication in the client chart is most likely responsible? And then review the telemetry strip of a client in the ICU. What do you see? That I see a bunch of ventricles by moving different direction, right? This is all VTAC. But what kind of VTAC? Polymorphic VTAC. Why? Because he has different shape. This is different shape compared to this. This is polymorphic ventricular tachycardia. This is what we call Torsades pontes. What is the number one cause of Torsades pontes? Low magnesium. And what does low magnesium cause to? QT prolongation. Which medication causes QT prolongation? It's not Lisinopril. It's not metoprolol. It's not lorazepam. Guys, what do you think? Azithromycin. These are macrolide, number one cause of QT prolongation, and it causes this problem. Now, this is a classic NCLEX question on PVC. Please know them. If you know, write it down. Which of the following the nurse should assess in the client with frequent PVCs? Premature ventricular contraction. There's certain things that causes that. A nurse has attended staff education program on causes of premature ventricular contraction. Which one? Number one is always electrolyte. But there's other things. If you stress, if there is something wrong with your heart, some medication will do that. If you smoke and you take some caffeine. But number one, if you don't remember anything, electrolyte, number one, low potassium. Watch for that. And this is a quick example of that. A nurse is caring for a client with frequent occurrence of rhythm on the strip. Which assessment finding will be most concerning and warrant immediate action by them? The client report feeling fatigue. Client has a heart rate of 88. There is a bunch of PVC in frequent and occur in couplet. That means in double. And the blood pressure is down. You can see blood pressure is normal. But this is the rhythm. This is how you read this. I see this and I say, this is separate. This is alone separate. And the heart set back. And then it's uniform. You can ignore this and you can see this rhythm is uniform, is sinus. But this alone is separate. It has its own. And it's mostly ventricular problem. This is what we call premature ventricular tachycardia. So, or contraction. Watch for that. Take a picture of it. Master it, because this will happen. When you see this, check the individual electrolyte. Therefore, if I'm seeing multiple of them, that's a problem. Patient has fatigue, it's not a big problem. His heart rate is normal. Blood pressure is normal. A bunch of it is a problem. Test-taking strategy. Which condition is the most likely a patient experiencing? Now we've moved to the point where I give you signs and symptoms and you tell me what is the patient suffering from. Can you do that? Stop the video. Now, I give you signs and symptoms and you tell me what is going on. How is this going to help you? Case studies, case studies, case studies. A client report syncope, number one, during exertion, chest pain, dyspnea. Connect these three together. When you listen to them, they have systolic murmur. It's a harsh systolic murmur on the right upper sternal border. Which condition is most likely experiencing? I'm not giving you a long case study, but the first three sentences, this is the way you can make a diagnosis. Please, I want you to master this. This is what I was told they're doing. Can you make a diagnosis with that? And that is why I've been calling this buzzword. When you hear this, something should be ringing. Chest pain, what? Syncope, chest pain, and dyspnea. Those three will give you the way. But then I give you additional one, systolic murmur on the right upper, right? That's the key. And it's what? Hash one. I'll give you a clue. When you see regurgitation, usually they are wholly systolic. Wholly systolic. This is not wholly systolic, so that is gone. And now exertional chest pain is mostly your aorta. When you try to exert yourself, that's where your blood is coming. That's what will cause syncope. That's much better than pulmonary. The pulmonary is on the other side, right? It's on the left side, left upper sternal border. This is on the right upper sternal border. So based on the location, that's how. If you have problem with this kind of question, you see the way I break it down, connect the dot. Based on that, this is aortic stenosis. So, but these are little questions, texting your knowledge, how to master them. Is they hard? Same thing. What does the nurse most likely suspect? Suspicion. A nurse is caring for a client. He has what? Palpitation. One, lightheadedness, right? The EKG shows what? Regular is uniform, while QRS complex at 180. Wow. There's a lot of stuff there. Let's break it down. If you know the answer, stop the video, put it in the comment, and let me know what you think. But let's break it down. I see palpitation. One. That's why you have lightheadedness. Okay. The EKG shows it has to be regular. One. If it's regular, which one can we eliminate? Tell me, put that in the comment. Afib is not regular, it's gone. QRS is wide. Oh, sinus tachycardia, QRS is not wide, it's gone. Heart rate is 180. SVT, you cannot be 180. Therefore, this has to be VTAC. You see the issue? You see the issue. At the same time, SVT is not the ventricular problem. The ventricle is wide. SVT, the ventricle look fine. Therefore, this has to be what? Ventricular tachycardia. They look hard, but I told you, after you finish this 85, you feel more confident to master the NCLEX. Trust me, cardiology, you're going to beat it. I'm talking about cardiology alone. This is cardiology questions, but you master how to answer them. Same thing. And next note, cold, motor skin, weak pulse, confusion, low blood pressure in a client who has a heart attack. Which condition the nurse should be concerned about? Ooh, is this difficult? Look at it. Concept. You have a heart attack. Boom. Your blood pressure goes down. Boom. Confusion. Oh, no blood flow. Weak pulse. No blood flow. Your skin look bad. No blood flow. And it's cold. After you have an attack, what will happen? Is it neurological problem? Is it hypovolemic shock? Is it cardiogenic shock? Is it septic shock? Put it down in the comment. Like I told you, signs and symptoms and make a diagnosis. I can tell you, if it's septic shock, your skin is warm. If it's neurogenic shock, your skin is warm. Now we're left with two, hypovolemic, cardiogenic. Hypovolemic, you're going to lose some fluid. This patient did not lose any fluid. Therefore, it has to be what? Cardiogenic shock. And this is ADAPT NCLEX, 85 questions, high yield cardiology concept. We're going through every aspect the NCLEX will trip you. This is based on recommendation from a subscriber, making it public for you to master your NCLEX on cardiology. How are you doing so far? Question 28. Same thing. Signs and symptoms and make a diagnosis. Don't get trapped. Which the nurse should prioritize workup for which condition? Oh, triage nurse is evaluating a client. He has what? Sudden onset of shortness of breath. Lung problem. Sharp chest pain, prurulatic chest pain. Is tachycardic and hypoxic. You cannot mix this. What condition? Forget about the bad stuff here. Go with the bad way. Shortness of breath. Okay, connected. And then you have chest pain. But what kind of chest? Prurulatic chest pain, not regular chest pain, not crashing chest pain. Therefore, This is gone. It's not crashing. This is gone. I don't see wheezing here. Asthma, you gone. Pneumothorax, worry about long sound. I never give you any long sound. You see, what is left? Pulmonary embolism. This is how you do case study and next generation case study, taking these little things and combine together. I create them as a question to help you recognize the cue for your NCLEX, so that if I give you these three words, connect them, recognizing cues, pulmonary embolism. And this is assessing a client who has what? Cold skin, what? Pale extremities, weak pulses, it sounds like less blood flow. And pain with walking that improve with rest. You walk, you have pain, then it goes away when you stop. Which diagnosis test should the nurse anticipate based on the most likely condition? What do you think is going on with this patient? His leg hurt when he walk. When he stop, he improve. The leg skin is warm, cold. Pulses are weak. What is this? Will you get an X-ray? Will you get an echocardiogram? You get an ultrasound or ankle brachial index? Once again, cold skin, weak pulses, they are pale. When you walk, you have leg pain. When you stop, it gets better. This is what? What do you think? What do you think? Claudication. If it's claudication, I'm not looking at your chest. If it's claudication, I'm not looking at your heart. If it's claudication, I'm not looking at your vein. That's DVT. I'm looking for your pulses, ankle brachial pulses. That's ankle brachial index. 30 question. About to finish 30. How are you doing so far? 85. That's our goal. Which condition should the nurse anticipate treatment for? Client with what? Sharp chest pain. One, buzzword. You're learning how to connect it now. That is worse when laying down. When you lay down, and improve when sitting forward. Oh, chest pain. If I lay down, it hurts. When I lean forward, it's much better. Is this heart attack? Is this pericarditis? Is this pulmonary embolism? Is it angina? I know they're going to tell me about shortness of breath here, sudden onset. I don't see it. Crashing chest pain, tightness. I don't see it. Angina, the pain of your chest improve when you exert, when you stop exerting yourself, but worse when you exert yourself. I don't see it. You said down, laying down, and leaning forward. That's classic pericarditis. Third question. What is your score right now? I would like to know. How are you doing? Are you mastering them? Is the question challenging? Like I told you, I'm taking you up and down, bringing you up and down like the NCLEX will do you. But this is the way I want you to master it. I'm your cheerleader. I'm hoping for you. Once again, question 31. Now, you can see that we've changed gears. Pediatric cardiology, people ran away from it. Congenital heart disease, congenital heart defect, they ran away from it. ADAPT NCLEX is going to make it easy for you. Which condition the nurse, the newborn most likely experiencing? Connect the two, right? Experiencing. Let's find the buzzword. Let me help you find the buzzword, make a diagnosis. A newborn is noted to have tachypnea, is breathing fast, is grunting, respiration, bad problem. His spleen, a liver is big, oh, bad problem. And he has stenosis. But if you can't figure it out, he said right to left shunt. Oh, there's a heart defect, and blood is being moved from what? Right side to the left side. That's why the kid is blue. That's all. Which one causes right to left? Anything that has T in it at the beginning is a problem. Oh, transposition of great vessel. I don't know this, By CT, I'm picking it. VSD, there's no T in the beginning. PDA, no T in the beginning. Coarctation of the aorta, no T in the beginning. You know your answer. You know what's up. That's T all the way. That's what we're picking. This is the right to left shunt. The rest are left to left shunt. And this is caring for a newborn with what? The same thing. Tachypnea, tachycardic, bounding pulse, continuous machinery. Why did I do this video? I want to help you understand buzzword. When I say buzzword, I mean it. Therefore, patient is breathing fast, heart rate is going up, pulses is bounding, and when you listen to them, they have like a machine like man. Connect this. This is your keyword. Which one causes that? Atrial septal defect, PDA, ventricular septal defect, coarctation of the aorta. Then you said, I know this. Coarctation of the aorta, they will talk about pulses of the upper extremities. I never said that. I said the pulse is bounding. If it's coarctation, I will say, oh, the upper extremities pulses is higher than the lower. This is gone. If it's VSD, what am I going to say? Holosystolic murmur. I don't see it. This is a machine. This is gone. This is systolic murmur. It has to be PDA. Machine murmur that's the problem. That's my key. You see, these questions are not difficult. I want you to learn how to recognize buzzword. That's ADAPT NCLEX way. What is the most likely diagnosis? Why? 5-year-old child present with what? Fatigue, is tired. Dyspnea on exertion. When he exerts himself, shortness of breath. He has tachycardia. Does that help you? Is he too generalized? It's okay. I said, when you listen to them, he has holosystolic murmur. But where is it located? Left sternal border. If this is the chest, it's on the left side. So this is the patient left side. It has to be patient left side. That's all. Then you tell yourself, oh, tetralogy of Foley, they have to tell me the kid is cyanotic. I don't see cyanosis. You see, you cannot make things up and force yourself to pick an answer. Work with what I've given you. This is what the NCLEX does. There is nothing in the case that said tetralogy of Foley. So if you're doing a case study and they say which one is the problem, there's nothing here. Aortic stenosis. The thing said holosystolic murmur on the left sternal border. Is that right? Is that the right location? Negative. Pulmonary stenosis, same thing, right? Look at it. It's in the lower. Your aorta and pulmonary, they are the upper portion. This is way here, way here. You see test-taking strategy? Lower sternal border on the left side. The aorta and the pulmonary stenosis, they will be upper, either left or right. Tetralogy of Foley, you're going to have cyanosis. Therefore, even if you don't know this, ventricular septal defect is your friend. You got to pick him. I'm not making it hard. I'm just giving you concept, the way to answer questions. And this is assessing a 2-year-old with what? Cyanosis. Now you see blue. When he cry, it turn blue. When you feed them, it turn blue. It's not gaining weight. Which congenital heart disease is that? That's all. Which of these causes blueness? PDA, ASD, VSD, they are what? Left to right. They don't cause blue. I give you all these things to confuse you, but there's a buzzword there, which is what? Cyanosis when you cry, cyanosis when you feed, and you're not growing because of CHF, and therefore tetralogy of Foley. Welcome to ADAPT NCLEX Cardiology Mastering. NCLEX Cardiology Mastering, NCLEX RN Cardiology Mastering, NCLEX RPN Cardiology Mastering. Let me know how you're doing. 35. Let's get it done. And let's care for a client diagnosed with what? Kawasaki disease. Which of the following the nurse should anticipate? Oh, what do I need to know? Write this down. Take this mnemonic, Kawasaki disease, and write T cramps. and then go down. A, presence of strawberry tongue. I see it here. Fever, more than 5 days. Temperature. Conjunctivitis, bilateral. C. I'm going to give you aspirin. That's the treatment. Immunoglobulin, that's the treatment. You're going to get rash, erythema rash. What do you see? All the answers are right. This is Kawasaki disease. T-cramps. How are you doing so far? This is ADAPT NCLEX trying to help you with cardiology, but I want you to master it. Watch this video multiple times, write all the concept down, and go take a question bank, and you can see that, oh, you aced this. Trust me, if you're not, I need to know. And this is providing discharge teaching to a parent of a 4-year-old with Kawasaki disease. What is the priority, okay? Which instruction should the nurse prioritize? Kawasaki disease, should you worry about new onset of peeling of the skin? If the patient is refusing to eat, if they have a fever, or if they refuse to eat and he has fatigue? Which one should you prioritize? Fever, fever, fever. So far as they have a fever, we have aneurysm. Therefore, I worry about you. Which findings are consistent with this diagnosis or disorder? Now we're back to a different condition. I'm giving you what? Signs and symptoms, and you make the diagnosis. Now we've changed it. We say, oh, this is the diagnosis. Tell me, what is the signs and symptoms? So if I tell you patient has appendicitis, what should they have? Same thing. A client with aortic stenosis, what should you see? This is how the select or apply NCLEX love it. I see aortic stenosis. What are the signs and symptoms? And look at it. You cannot even make this up. It's so straightforward. This is the aorta. It's blocking. When you pump your heart, the left ventricle pump, blood doesn't flow. You're going to have syncope. Should you be surprised? That's the symptom. You're going to have heart murmur, systolic, when the ventricles try to contract. What is going to happen? You're going to have chest pain because there's no blood flowing. Your pulse is not going to be what? Pounding. It will be decreased because there's no blood. You're going to have blood backing up, and you can have dyspnea. They all make sense. It's pathophysiology. And that's how you do these kind of cases. Pathophysiology. Same thing. A client experiencing digoxin toxicity. What do you know about digoxin? Which symptoms should the nurse caring for the patient monitor for? Select or apply. Nausea, vision changes, bradycardia, Statins, palpitation. What are the signs and symptoms of digoxin toxicity? Just write it down. Draw your caricature. They're going to have neural problem. I don't see there. Their eyes is there. Vision problem. I pick it. Their GI tract, GI symptoms, nausea. They're going to have cardiac, Brady. Kidney is going to get into trouble. Digoxin causes Brady. You can't have Brady and causes palpitation. It does not cause any tinnitus problem. This is how you break it down, guys. ADAPT NCLEX. Let me know in the comment section. How are you doing? A client is receiving a beta blocker. Beta blocker. Questions are not designed from app. We make it based on concept. What is the concept? Beta blocker. What does it do? It blocks your heart. It slows down your heart. What effect would you see? That's all. If my heart is being blocked, well, my heart rate is going to decrease. My heart is being blocked, my blood pressure will decrease. If all of them is happening, I'm going to get tired. What does the blocker does in your lung? It causes constriction. Another side effect, is what? Beta agonist, which decreases your potassium, and this one will increase your potassium. So hypokalemia is the wrong answer. It should say hyperkalemia. You see the difference? That's the way you approach it. Which finding, number 40, which finding should the nurse anticipate on assessment? That means anticipated finding. A nurse is caring for a client who is 2 days post-abdominal surgery. He just had abdominal surgery. The nurse suspects deep vein thrombosis, DVT. Write it down. Connect the dot. Patient has DVT after surgery. What should I see? Calf tenderness or aching? The leg is going to get warm. Temperature goes up. What? Pulses is going to decrease. The skin is going to look pale and swelling in both legs. What do you think? This is how they will trap you. Trust me, DVT, they can put this question there and then you over-select. What do you think? It look all bad. This is your vein, your leg, and the vein, okay, is blocked by clot. You have DVT. It's going to swell, but it's the leg that is affected, not both legs. You're going to have tenderness there, calf, and the temperature going to go up. It does not affect your pulse unless it's a severe form. NCLEX is not going to ask you that because that's advanced. Your skin is not going to change. There's no change in blood flow. The skin is going to look warm. Guys, so which one would you pick? What do you think? Calf tenderness and increase in warmth. That's what you see in DVT. Which findings are consistent with this condition? What condition? And then a client with acute decompensated heart failure is being assessed. Buzzword is decompensated heart failure. Watch for that. I never said left or right-sided heart failure. Acute decompensated. Can you worry about it, huh? Will you see weight gain, dyspnea, H3 gallop, increased edema, and bradycardia? What do you think? What do you think? When they said decompensated, it means left and right. Therefore, I'm going to see left and right heart failure. Weight gain, A, right-sided heart failure. Dyspnea, left-sided heart failure. 3, gallop, left-sided heart failure. Edema, right-sided heart failure. You're not going to bradycardic. Your heart rate will try to go up. So these are signs and symptoms you will see. How are you doing so far? 41. Almost there. Which cardiac manifestation should the nurse expect? An expected finding of what? A client with severe hyperkalemia. This is electrolyte, EKG changes. You have to be comfortable with what EKG changes you may see based on electrolyte. Like I said, these questions are hard. If you're able to go through, you can see you've mastered every angle of cardiology. Hyperkalemia. Does it call flattening T wave, ventricular arrhythmia, weakness, prolonged QT, and Torsades? Let me know what do you think. Put it down in the comment and let me know. But hyperkalemia causes peak T wave, not flat. It's going to irritate your heart, ventricular arrhythmia, right? I'm making sense out of it. Too much potassium will make your muscle weak. What is the problem? Weakness. Prolonged QT and Torsades are associated with what? Low magnesium. And therefore, what is your right answer? Ventricular arrhythmia and weakness. You can see this is electrolyte, fluid electrolyte. I have a bunch of fluid electrolytes and their manifestation on EKG on my ADAPT NCLEX YouTube channel. Subscribe for more content like that. Which outcome are consistent with the expected effect and concentration of the medication? A bunch of words. Try to break it down. He said, make it small. He said, outcome, what is going to happen? Consistent, the same thing. Expected, same thing. These are designed to confuse you, right? And consideration, that means when you're on this medication, heparin, what should I see? Your PTT is going to go up. You're going to have less clot formation. You're going to have bleeding risks. We're going to reverse you with prothemy, and your urine is going to take green. What do you think? Anybody on heparin, does that apply to them? Of course, PTT goes up. You're not going to clot. You're going to bleed, and we will need prothemy to reverse you. Your urine, if you're bleeding, is red. A client taking statin is being assessed. Okay? Which finding require immediate reporting? What is the major side of what? Statin. That's all. That's what the NCLEX is going to ask you. Muscle pain, urine clear, elevated CK, fatigue, and a peak T wave on the cardiac monitor. I would like to know what you put for this, but this is a hard selected apply, require critical thinking. Like I said, you don't have to pick everything. What do you think? Starting, the major side effect we worry about is muscle damage. If there's a muscle damage, you're going to have pain. If the muscle die, you go to your kidney. Your urine is not clear, dark. The muscle release protein is called CK. You may get tired. And the muscle die, it releases all the potassium. You have peak T wave on the monitor. Was that a surprise to you? Was that a surprise to you? Now, they said which one require immediate reporting? That means bad ones. Muscle pain is bad. CK elevated is bad. Peak T wave is bad. Fatigue is not bad. Therefore, I'm picking this, that, and that. That's what the question says. Immediate reporting. Fatigue does not require immediate reporting. Where are we? Still, signs and symptoms and figure out what is going on. A client with what? Severe hypomagnesemia is being assessed. Which EKG findings should you anticipate? Electrolyte, fluid electrolyte. There's a bunch of fluid. There's a bunch of electrolytes with side effect on the EKG. There's a bunch of electrolytes that have manifestation on the EKG. Which EKG findings should the nurse prioritize? Torsades, PVC, prolonged QT, flattened P wave, and a peak T wave. What do you think? We've seen peak T wave. I told you it's potassium. It's gone. If you have low magnesium, tends to be excitable. P waves, no. Flat T waves, no. Number one cause of hypomagnesemia, prolonged QT. It's going to excite you to have PVC. And then you have Torsades that lead to prolonged QT. That's one. Those are the signs and symptoms of hypomagnesemia. Now we are on 46. We're almost 48 questions away. What do you think? A client with anemia-induced tachycardia, that means your blood level is low, you have tachycardia, is being evaluated during a routine visit. Which assessment finding is consistent with the diagnosis? Think about it. If you have anemia, are you going to be fatigued? Is your skin going to look white pallor? Are you going to have dyspnea? Are you going to get high output heart failure? And your temperature is going to get low. Think about it. Put that in the comment. But if you have anemia, you're going to get tired, less blood flow. Your skin is going to get what? Pale in color, your eyes. When you walk a little bit, you become tachycardic and you have dyspnea. And what is the problem? Your heart will try to push very fast. You get a heart failure. But your temperature, yeah, it doesn't affect your temperature that much. So those are signs and symptoms of anemia-induced tachycardia. Hey, this is my favorite question. It's a trap. And this is what? Preparing a client for a discharge who has been prescribed Lisinopril. Which teaching points should the nurse include? This is what? Selected apply. What kind of select apply? On pharmacology. What is Lisinopril does? It lower your blood pressure. We talk about the side effect. Angioedema, cough, electrolyte, and what? Teratogenic. Rise slowly from a sitting position. Is that what you think? Oh, add fish, avocado, strawberry, tomato to your diet. What would those do? It increase your potassium. Take the medication with food to reduce stomach upset. Do you need to take it with food? Is it like a must? Check your pulse 1 full minute. Do I need to check my pulse? It does not affect my heart rate. Expect increase in urination. It's not diuretic. Therefore, this is the only one. It's a selected apply. If you select, you get 0. The client being discharged on digoxin for heart failure. Pharmacology. We are now switched back to pharmacology. You see, I take you up and down. Which statement indicate need for further teaching by the nurse? I will inform my healthcare provider if I develop nausea, GI symptoms. Is that what you think? I will increase my potassium intake. Oh, do you think potassium affects digoxin? I will need drug level check frequently. Oh, yeah. I will check my apical pulse 1 full minute for each medication that I take. Yes, you need to check your medication. You check your pulse. Hey, we need to check your drug level. GI symptoms, let me know. You should not do anything to your potassium. Keep it normal. Need further teaching. And this is caring for a client who is status post what? Transplant. What? Heart transplant. Which immunization should the nurse expect to record in the client medical record? This is critical thinking, test-taking strategy on immunization pharmacology, and then NCLEX strategy. I have a heart transplant. Which immunization would I need? Influenza, inactivated, pneumococcal vaccine, varicella, Tdap, MMR, or a B. What is the question ask you? Ask yourself, what is it asking you? They talk about heart transplant. Something should be ringing your ear and say, oh, heart transplant, immunosuppression. They're getting immunosuppression. And they should avoid live vaccine. Which of this is a live vaccine? I cannot give it to them. Therefore, which one should I give it to them? That's all. This is inactivated. It's not live. Pneumococcal is not live. Tdap is not live. B is not live. Varicella, MMR, they are all live. 50. And this is caring for a client prescriber. Toffee, delete. Which EKG finding should the nurse monitor the client after administration? This medication, I want you to write it down and know it. Toffee, delete. The major side effect of this is the ST elevation, T wave inversion, peak T wave, or prolonged QT interval. It causes what? Conduction problem, QT prolongation, and this may be potentiated by low potassium and low magnesium. Therefore, this is what we do. 50 questions. Thank you for sticking around. 35 more. Are you ready? Challenge me. Prove it to me. Let's go. Let's ace this. Master this cardiology so that you can be comfortable. You don't worry about it. Like I said, make a video, combine these two, and you have a library of succeeding on cardiology. Question 51. How are you doing? You almost there. Same thing. Pharmacology. How should the nurse respond? A client taking furosemide state, I would drink as much water as possible to prevent dehydration. That is correct. Drink extra fluid. Encourage the patient. Do not increase fluid intake excessively. You should take it before bed. You do not need to monitor potassium. Guys, put down your answer. Let me know what you think. But I can tell you, if you take furosemide, you become hyponatremic. If you drink too much fluid, you do what? Make the hyponatremic worse, and you get into trouble. Therefore, don't overdrink it. And this is caring for a client with what? Supraventricular tachycardia, that is SVT, who is prescribed adenosine, which action require immediate intervention by the church nurse. Select or apply. Or the question is asking you, break down the question. SVT, prescribe adenosine. Which one require immediate intervention? That means you're doing something wrong, that you're taking the adenosine, you're giving to the patient the wrong way. 6 milligram administered at first dose. Is that what you give? The first dose 6 milligram? Yes, followed by 12 milligram. Dose given over 15 seconds. Is that what you do? Then you flush it with 20 ml of saline. Then you tell the client you're going to have some flushing. And your IV should be below your elbow. That means way distal. What do you think? Put down your comment. Let me know. Put it in a comment. Let me know. I can tell you your IV should be proximal to your heart. So therefore, this requires intervention. That's what I'm worried about. Inform the client they'll be flushing. Yes. Then you push it with fluid. But the time you inject the medication should be 1 to 2 seconds. 15 seconds is too much. So those are the things. So 1 to 2 seconds, IV close to the heart, push it so fast, and then tell them about the condition. That's adenosine. Now, what are we going to do? This is generalized cardiology key concept. Which condition the nurse should suspect? What is that? Concept related to that. A nurse is assessing a client who presents with chest tightness during activity. When you are exerting yourself, you have chest tightness. That goes away when you rest. Your EKG shows ST depression during exertion. I'm trying to help you guys learn how to read case study and questions. This is what I've given you. Signs and symptoms. The subscriber who passed the NCLEX keep on saying signs and symptoms. You have chest tightness, signs and symptoms. When you're moving, signs and symptoms. But it goes away when you rest. And your ST is depressed, not elevated. If it's not elevated, it can be MI. If your chest tightness is not relieved by lean forward, it cannot be pericarditis. I never told you anything about that. And your chest tightness happen when you're doing activity, it can be unstable. Unstable is at rest. You see how you break it down? You got to be stable angina. Which assessment findings should the nurse expect? Same thing. A nurse is interviewing a client, he has mitral valve stenosis, who report fatigue, dyspnea, exertion, and atopnia. What do you see? Wide pulse pressure, bounding peripheral pulses, pulmonary crackles, and bradycardia. Look, when they give you a question, don't even think about looking at the answer. Try to break down the question. Expected finding. Okay, what is that? Mitral valve prolapse, right? Stenosis. This is mitral valve. You see it. Blood comes from your lung and it go through the mitral valve before you go to the ventricle. If I have stenosis here, blood is going to back up into my lung. That's all pathophysiology. I should not see wide pulse pressure. You see it with regurgitation. I should not see bounding pulse because the blood is not even going to the ventricle. I will be tachycardic. Everything is about my lung. There's only one thing, my lung, my lung. That's what I'm worried about. And this is caring for a client with what? Irregular buzzword, rapid heartbeat, fatigue, and palpitation. ECG show no P wave. What do you think? I've described a condition, an EKG condition that you should be familiar with. Is this Afib, VTAC, Brady, and atrial flutter? Put it down in the comments. Let me know. But look, buzzword, irregular. Oh, and there is no P wave. Forget about palpitation. Any of them can do that. Fine. I know it's not VTAC. If it's VTAC, I won't talk about P wave. If it's sinus Brady, I will say what? No palpitation. If it's A flutter, the word I will use is what? Regular and what? Sawtoothed. buzzword. That is ADAPT NCLEX way of helping you memorize this, learn it, make sure it's part of you, and you will face this information without any problem. Which condition should the nurse prioritize? Okay, which condition? I'm giving you signs and symptoms and tell me what is the problem. And nurse is assessing the client who has what? Sudden buzzword. What? Chest pain. 1. It goes where? To the left arm. 2. And you're sweaty. Oh, something should pop in your head right now. The client is also anxious and pale. Signs and symptoms, guys, you can master and ace this thing if you don't know signs and symptoms. Because if they give you a case study, if they give you a question, stand alone. If you know the signs and symptoms, you connect it to the bars where they said, boom. Even they use this for prioritization. So those are the buzzwords. I keep on listening to my videos. You see, I keep on using buzzwords. And you ask yourself, is this pulmonary embolism, myocardial infarction, angina pectoralis, and pericarditis? We just saw similar one here. Well, pericarditis, there have to be something here. Even though you have chest pain, relieved by leaning forward. If I don't see that, it can never be pericarditis. Therefore, this is gone. Angina pectoralis. Oh, exertional chest pain. It does not go anywhere. Myocardial infarction. Oh yeah, you go to your leg, you die your extremities, you diaphoretic. Yes. I never mentioned shortness of breath. You see, go with the buzzword, not the condition. And nurse is caring for a client who recently had what? A nurse is caring for a client who recently had automatic implantable cardiovertebral defibrillator place, AICD. That means just a pacemaker, okay? Which statement by the client indicate the need for further teaching? Pacemaker to help with the heart. Which one? I can lift my arm above my head on affected side when I want. I should call my provider if I feel shock from my device. I need to avoid MRI unless my provider said it's safe. I can use a cell phone next to my AICD if I want. I should check my incision daily for redness and drainage. Look, this question, every time, everywhere you go, if they ask you, this is what they're going to ask you. So know it. What? Pacemaker. What do you teach the patient? That's all. What do you teach the patient? You cannot lift your hand above it. Further intervention. If you feel like you're being shocked accidentally, let us know. You can't use MRI because they magnetize you. You can't put the phone near it. It's going to demagnetize the thing. You need to check the signs for infection. You see, that's all. And the client has just returned from surgical unit after endovascular abdominal aortic aneurysm. Pay attention. Which intervention should the nurse include in the plan of care? Write it down. Endovascular aortic abdominal aneurysm repair. What do you think? I go through your groin. That's what it is. I go through your groin and I fix your aorta. When I come back, bleeding is my major thing. And your groin. Do you want this patient to work? Encourage early ambulation within the first hour. What is the concept? Monitor urine output hourly. What is the NCLEX NCLEX concept? Assess pedal pulses regularly. What is the concept? Keep blood pressure within prescribed parameters. What is the concept? And assess the groin for hematoma. The concept is to prevent bleeding. Therefore, remain flat at all costs, at least 6 hours. You can't walk an hour. It's not part of the plan. We are not putting in. I got to monitor your urine output because of your kidney. I got to check for pulses. Make sure it works. And your blood pressure, we should not increase it. So within the parameters prescribed. And the number 1, check for bleeding, growing. That's all, guys. That's the answers. I love this question. A nurse is caring for a school-age child diagnosed with heart failure. Okay, a young kid, heart failure, school age. Which of the following age-appropriate activity is most appropriate for the kid? It's not the difficult question, growth and development, but it's based on cardiology. If you have heart failure, should you be having a competitive soccer? Should you be watching a video game or board game? Should you jump rope with your friends? Should you relay races in the what? In the gym class? Should you do that? Should you? I think you should stay away from any activity that will bother your heart. Therefore, what do you think? Video game, you're sitting down, playing, low impact activity is much better for you. At least this is all you need. This is what he's testing. And this is caring for a client who has just returned to the cardiac unit after repair of what? Thoracic aortic aneurysm. We just repair it. Which intervention should the nurse include in the plan of care? SATA apply. Thoracic is in your chest. That's the key. I'm giving you the buzzword so that you can know it. Thoracic aneurysm. I go to your chest and I fix it. Therefore, what do you think? Urine output monitoring, incision on your abdomen, the groin for hematoma, your pulses regularly, and your blood pressure above 140. Let me know what you think. Stop the video, put down your answer in the comment, and explain yourself. Let me know so that we can talk about it. Conversation. Which one is confusing you? If I go to your chest, you don't need incision on your abdomen. Where I got to monitor your urine output, your kidney, or every time you go to surgery, you got to do that. I did not go into your groin. It did not say endovascular. It said thoracic, chest. Therefore, no groin check. Of course, I repair an artery. I got to check your pulses. If your blood pressure is high, you're going to bleed. Therefore, I should not increase your blood pressure too much. We got to lower it. So these are your right answer. You see how test-taking strategy trying to get you thinking. And next, care for a client with what? Infective endocarditis. You see how I'm taking you, and you can see these are prioritization. I've changed the thing into prioritization cardiology. Which assessment finding is concerning, right? Expected finding. If you have endocarditis, what should you see? From Jane, that's what I call it. From Jane. If you from Jane, you can have splinter hemorrhages. That's the splinter hemorrhages, expected finding. You're going to have F, which is fever. Leg pain, I don't expect it. Retinal hemorrhage is the rotor spot. Therefore, write it down. From Jane. Again, from Jane. Okay, fever, rotor spot, Oslo node, heart murmur, Janeway lesion, anemia, nodule, emboli, and then what? Splinter hemorrhages. All this expected finding. If you have leg pain, the clot has gone to your leg from the heart, and therefore the bacteria. Therefore, anybody with endocarditis, you should not see leg pain. When you see it, they are in trouble. And let's care for a client with what? Acute myocardial infarction. Which prescription should the nurse anticipate? Procedure, concept, strategy to answer questions, CT scan, electroencephalography, PCI, percutaneous coronary intervention, coronary bypass graft. Hey guys, look at the question. Patient has heart attack. MI. This is the heart. The vessel here is blocked. That's why your heart muscle is dying. What prescription should you expect? Do you think we're going to order cardiac CT to look at this? This is going to your brain. Am I going to check your brain for seizures, percutaneous coronary intervention, or are you going to get surgery? We just have to go and open the blockage. What are we going to use it to do that? PCI. This is where they go in through the groin and they put the stent in. That's all. It's a test-taking strategy in critical thinking. And another healthcare provider are performing 2 rescue CPR on a 3-month-old. What is your concept on CPR on a young infant? Which action is appropriate? Compression and ventilation is 30 to 2. How deep do you compress? Is it 2 inches? How much compression do you deliver? 100 to what? 120 per minute? And when you check in the brachial pulse, do you check it for 20 seconds? Put it down in your comment section. Let me know what you think. I can tell you 20 seconds is too long, less than 10 seconds. And how much compression do you do? 100 to 120. They're small. 22 inches is too big. It's too deep. 1.5. And if there is a 2 rescuer, it's 15 to 2. Unless you are single, it's 30 to 2. Therefore, this one. A 2-year-old child returned to the unit after tetralogy of oral repair. We're back to pediatric. You see what I did to you? Back now, pediatric. You ready for PET now? PET cardiology, pediatric cardiology, pediatric nursing cardiology. Which finding indicates the nurse should intervene immediately? If I repair tetralogy of oral because you are hypoxic, will you have pain, incisional pain? Will your heart rate go to 110? Do you have peripheral edema or splenomegaly? Or do you have oxygen saturation of 95? Let me know what you think. This is a strategy, critical thinking. I would like to know what you think. Stop the video, analyze the question, put down your answer, and let me know. But I can tell you, tetralogy of folate, what do they have? Your saturation is never good. I see 95 roommate. You good. I'm not worried about you. You have a heart surgery. You're going to have incisional pain. Don't worry about it. Now you're left with this. Why would you have peripheral edema and an hepatomegaly? It looked like right-sided heart failure. What is the major complication from tetralogy of folate? Heart failure. Your heart rate 110. It's a 2-year-old. That's normal. I'm picking this. That's the right answer. Number 3. C. Which is the most important for the nurse to teach? What are you going to teach? A parent asks about signs of what? Congenital heart disease worsening in their infant at home. In their infant at home. How would I know it's worsening? Blue, cyanosis when they cry. Persistent poor feeding and lethargy. Mild sweating and feeding. Slight weight loss over 1 week. This is a critical thinking question. They have a congenital heart disease. You can put anyone you want over there. But which one would I know they're doing bad? If they have cyanosis when they cry, the tetralogy of folate does that. If you have poor feeding and lethargy, I don't like this word. Sweaty and feeding, this is what? I said congenital heart disease. So it can be left or right. This is a right to left shunt. My sweaty and feeding is usually what? Right to left. Slight waist loss, same thing. But if you have lethargy and poor feeding, it's a sign of CHF. What is the major complication for these two? CHF is a bad problem. Which finding require immediate notification of the provider? PET cardiology can be intimidating, but think about it like friendly and then go with the concept. You master it. A child returned from surgery for what? VSD. Same thing. It does not matter what is the condition. Heart failure is the major problem. His capillary refill is 2 seconds. Do you worry about it? His heart rate is 110. He has a pneumoma and decreased urine output. A mild incisional pain. It's the same information I changed it. VSD, take it away. Put a congenital heart disease. And if you have heart surgery and your capillary refill is 2 seconds, you are perfusing. Your heart rate is a child. We don't know. 110 is not bad. But you have a heart murmur, is what? New one, you have a CHF. your urine output is decreased. Is CHF the same concept? You're going to have incisional pain. I'm teaching you some of the things. Take the concept, write it down. I keep on saying, repeating the same. It's because there's nothing you can do except use the concept to answer the question. VSD, the tetralogy of fluid, no matter what. After surgery, worry about heart failure. Write it down. And then, as I said, a 10-year-old child with coarctation of the aorta. The person who passed the NCLEX told me signs and symptoms. This is the signs and symptoms. Or they will give you the name and you have to find signs and symptoms. What do you know about coarctation of the aorta? What are the signs and symptoms? Well, bounding pulses in the lower extremities. Is that what you see? Weak femoral pulses and high blood pressure in the ham. Cyanosis of the fingers and the toes, acral cyanosis. Diastolic murmur at the apex. What is the classic of coarctation of the aorta? The aorta is having stenosis. Therefore, your blood pressure on your upper extremity should be higher than your lower extremities. That's all. Weak pulses and high blood pressure is better. Your pulses shouldn't be bounding at the lower extremities. It has nothing to do with cyanosis because they are not blue. And then she's teaching the parent of a child with a small VSD, little one, which statement indicate parent understand the condition. He says it's a tiny. Our child will need immediate surgery. Buzzword. VSD is what? Right, left to right shunt. They don't need surgery right away. Some small VSD may close spontaneously. Maybe. Our child will likely develop cyanosis early. Like I said, it's the left to right. They are no blue. Activity should be restricted, limited to prevent complication. Why? They don't need surgery. The teen said is very small. Why do you want to restrict the kid? It's not that difficult. It's all based on buzzword. Small one, we don't worry about it. What is the next priority? Teaching for a client on tonight. We're back to pharmacology again. I keep on taking you high and low. How is your pharmacology? Bumetanide is what? Loop diuretic. Should you avoid sunlight? It's a photosensitivity issue. Increase fluid intake at night so that you don't what? Get dehydrated. Change position slowly and take on empty stomach. You don't need to worry about taking on an empty stomach. If you drink water at night, you're going to pee all night. It's a problem. Sunlight, of course, but orthostatic hypotension is more dangerous. So I will prioritize that one. Which of the following findings indicate that the medication is effective? What medication? And this is caring for a client with acute MI who is receiving atenolol. Patient is receiving atenolol. How do I know this is effective? Their blood pressure is 88/50. Their glucose is 200. Client report no chest pain. Respiratory rate of 29 and a ventricular rate of 75. This is test-taking strategy. What do you think? What do you think? I have heart attack and I'm taking beta blocker. What's the purpose of the beta blocker? This is to indicate effectiveness. Well, it's a beta blocker. It will slow me down. Do you see anything slow down here? This is good. You lower your blood pressure. That's what the intended effect. It's too low. You are not hypotensive. Rate control does not mean I got to make you hypotensive. It's what? Sugar is up. It's not what I expect to happen. You have a heart attack. You will not have any more chest pain. I love it. You breathe in too fast. I don't like it. You see the strategy? You see the strategy. I don't like it if you breathe in too fast. Therefore, this one and that one are our answers. 70. How are you doing so far? You're almost there. 15 more questions. What do you think? 15 more questions. You should pat yourself on the back. And thank you for staying around. Like I said, signs and symptoms, condition, signs and symptoms, nursing care, pharmacology, with mastering cardiology, every concept needed. 71. Where are we going? Same pharmacology. A client, 6 clients are on digoxin for heart failure, which the nurse should follow up with which situation. Which one is a priority? It's a condition, toxicity. An adult is apical pulse is handed. A child, he vomit once on digoxin in the morning. He said, need a follow-up, right? The child who has no appetite, need a follow-up. Adult, he has yellow vision, need a follow-up. Neonate with a ventricular septal defect, need a follow-up. And a child with severe diarrhea. We already seen digoxin. No digoxin. Know everything about it. Digoxin NCLEX. Look, GI symptoms is number 1. If you have diarrhea and you have no appetite and you vomit, I got to follow up and see what is going on. If you're adult, your apical pulse is 100, it's okay. But you have yellow vision, is a problem. Toxicity. VSD, just because you have congenital heart disease does not mean you can't take digoxin. Therefore, that's not the problem. And let's ask why they need to take what? Amlodipine and furosemide at the same time. What is the best response? They are different things. Amlodipine is a calcium channel blocker. Furosemide is a loop diuretic. Therefore, they work together to protect your kidney. Negative. They target different ways your body control blood pressure. Is that so? One is a backup in case the other doesn't work. What do you think? They help with the heart burn and the fluid retention. Support each other. What is the purpose of potassium chloride in this regimen? And then it's reviewing digoxin, furosemide, potassium chloride for a client. Why are they taking all these 3 combinations? Prevent dehydration, reduce digoxin effectiveness, prevent potassium-induced toxicity, enhance furosemide action. What do you think? When you take digoxin, you got to worry about your potassium. When you take furosemide, it's going to lower your potassium. Therefore, we have a potassium replacement, where if you're losing potassium, your digoxin will become what? Toxic. Therefore, I give you potassium because I know furosemide will lower your potassium. In the process, I'm preventing potassium-induced toxicity. Excellent. You see the way you break down the question? Which findings are expected of what? Pulmonary edema, right? Suspected pulmonary edema. Think about it. There is fluid in your lung. Are you going to have pink, fluid sputum? Are you going to have severe dyspnea? Are you going to have hyperresonance on auscultation? Are you going to remain calm if you have pulmonary edema? Are you going to have dry cough? Think about it. Think about it. Hey, pulmonary edema means you're drowning. There's fluid in your lung. Your vessels burst open. When you cough, there's blood in it. One signs and symptoms on the NCLEX about pulmonary edema is what? Pink fluid sputum. If you have pink fluid sputum, you're going to have severe dyspnea. I never said anything about what? Too much air in your lung. If there's too much air in your lung outside your lung, you're going to have hyperresonance on auscultation. This is pneumothorax. You are not going to be calm because you what? Having dyspnea, negative. If you have pink fluid sputum, you're not going to have dry cough. Therefore, those are your right answers. 75. A client with what? Complete heart block. There's no communication between the atrium and the ventricle. What would you see there? PR interval is going to increase. There's going to be some drop of your QRS complex. Your heart rate is going to go down. You're going to have ST elevation. That means MI or Y complex. Think about it. It sounds difficult, and you think you got to run away from it. This is your P wave. This is your QRS, then T wave. If there's a complete heart block where there's no relationship between the atrium and the ventricle, in the process, what is going to happen? This PR interval can get longer. Sometimes if the atrial contracts, the ventricle doesn't go. So you're going to have drop. You see how I'm breaking down. If you dodge that, it's a block, heart block. You're going to have bradycardia. It has nothing to do with having heart attack. Neither is your QRS going to be changing. It's going to be the same, except you're going to lose it. Therefore, this and that. When you see questions like that and you feel like you want to run away, spend some time, step back, break down the question, figure out what is going on, add them together. And it's a selected reply. Don't run away from it. Pick those that you're confident and look at the content they've given you. The answer is in the question, and that's third-degree block. A client with what? Peripheral artery disease. That's your buzzword, right? It's being evaluated. What should you worry about it? What should you see? What should the nurse anticipate? And I said peripheral arterial disease, less blood flow. Less blood flow. Which of these indicate less blood flow? A loss on the leg, cold extremities, collar with elevation, pain relief by dangling the leg, and bounding pulses. All the things I've done with these cases, questions. Look, if you write everything down, the concept, the disease process, and the signs and symptoms, and you learn them, trust me, there's no question that will beat you, because I've given you the major signs and symptoms of peripheral arterial disease. If you take the concept, case study, you will beat it. Less blood flow. Which one indicate less blood flow? If there's less blood flow going to your leg, you're going to lose all your hair. Should you be surprised? Expected finding. Less blood flow. Blood is warm. Your skin is going to get cold. If you elevate your leg, there will be more and more less blood flow. Therefore, your skin is going to look white. If you put your leg down, the pain get better. The pulses is not going to be bounded. Is that something that you should let NCLEX take away from you? Do it like that. That's your strategy. Use the concept to answer the question. One word to look for the answers. Same thing. A client with exacerbation of chronic venous insufficiency, like I told you, it's a complex. It tackles every aspect of cardiology that you need. With findings, should the nurse anticipate? Selected apply. Brown skin, leg edema, varicose vein, cold extremities, diminished pulse. And you ask yourself, whoa, why all these things? Too much blood is the problem. Therefore, your skin is going to turn what? Different color, brown. Too much blood lead to edema. Too much blood will make the vein engorged. If there's too much blood, your skin is not going to get cold, neither is your pulse going to diminish. This is the way I do questions, just to give you the concept so that you can memorize them and use them when you answer questions. Assessment findings are consistent with this diagnosis. What? A client with acute pulmonary edema is being evaluated. We saw it, right? Same thing we saw. Why did I repeat similar topic? I changed the answers. If you have pulmonary edema, will you have chest pain? Will you have dyspnea on exertion? Will you have tachycardia? Will you be hypoxic and bradycardic? I'm trying to let you think, like take the concept. I have fluid in my lung. I'm drowning. Would I have chest pain? He said pulmonary edema. Just because the words are bad doesn't mean you got to pick it. Doesn't mean you got to pick it. Of course. Pleuritic chest pain is still the same thing. When you exert yourself, hey, dyspnea. You'll be looking for air. If I'm looking for air, tachycardic, I'm not going to be bradycardic. And I'm going to be hypoxic. Which Cardiac finding will the next aspect of what? A client with what? Septic shock is undergoing hemodynamic monitoring. What do you think about septic shock? What should you see in this? Shock is hypoperfusion, and therefore I know blood pressure is going to go down, but specifically for sepsis. Will my heart rate go down? Will my blood pressure go down? We already seen it. I said it already. I give that one away. Will my skin be flushed later? Skin flushed late. Will my skin is going to get what? Cold and clammy at early stage? And would I have tachycardia? It's a shock. You have perfusion problem. Your heart rate is not going to go low. It's going to get high. Septic shock, it makes your vein bigger. Early phases, there's more blood to your skin. So your skin get warm. That's the difference between septic and what? Hypovolemic shocks. Therefore, this is wrong. The warm occur early, and the late, your skin become what? Clammy and flabby. Therefore, watch for that. Warm skin early and cold and clammy skin later. 80. You'll be left with 5 questions after this. How are you doing? I got to check on you. Make sure you mastering it. Make sure you're taking note. Make sure you're stopping the video. I don't want you to miss any key point. And if you do that, you get a whole note of cardiology. You can just read it multiple times. Say, oh, I know everything. And you combine to the lecture I did on Saturday, the video, you should watch it. It's a classic walk in the what? All way of cardiology. If you combine these to that, you have golden weapon for cardiology. And if you're in nursing school, this is all you need. A client with constrictive pericarditis is undergoing assessment. Pericarditis constrictive, that means it's pushing really hard. It's not cardiac tamponade yet, but it's squeezing your heart really well. It's not only acute, it's constrictive. Now your heart is in trouble. What finding would you see? JVD, pericardial knock, ascites, edema, loud STD. There's a reason why I spend time trying to give you the concept. So this is your heart. When you have acute pericarditis, you can have the pericardium get thicker. When it becomes constrictive, it's so thick, it can lead to tamponade. So which of these tell you is constrictive? You're going to have a heart failure. Everything is going to back up. So that's why you're going to get JVD. You're going to get friction rub, pericardial knock. This is heart failure, ascites, right-sided heart failure. Edema, right-sided heart failure. And what? Loud S3, it means too much fluid in your what? In your heart. This is not going to be happy because we're squeezing you. When we squeeze you, you can't put fluid in your heart anymore. So S3 is not possible, but this is a trick one. So it's A, B, C, D. You got to look at it carefully. When I see loud S3, that means there's too much fluid in your heart. When you have constrictive pericarditis, we can't even bring fluid to your heart. So that's the thing. So S3 indicate volume overloaded, right? In constrictive pericarditis, there's reduced ventricular compliance. So S3 is not possible. 81, 5 more questions. Thank you for staying around. Thank you for watching this video. Thank you for learning something. And let's haste the NCLEX. What is the most appropriate nursing intervention? What would you do? Client with peripheral artery disease complain of a severe pain when walking, which is relieved by rest. They're describing claudication. What teaching do you teach them? Nursing concept for RN, what? Nursing NCLEX concept. Encourage the client to rest as much as possible. Recommend that the client elevate the leg above the heart. Suggest that the client stop smoking and start the walking program. Apply a warm compression to improve circulation. What do you think? Encourage the client to rest as much as possible. No, the idea is to walk to the place where you have pain, stop, and then proceed. If you elevate your leg, you're going to have what? More power, more pain. Suggest them to stop smoking, prevent the risk factors, and walking, improve blood flow. Warm compression. You can't feel your leg. You're going to hurt yourself. Number 3 is the right answer. 82. A perioperative nurse is evaluating a client's schedule for endovascular repair for abdominal aortic aneurysm. Which assessment data is a priority? Long sound, heart sound, peripheral pulses, assess for valve sound. This question is test-taking strategy. The patient has what? A bunch of information in the question. Endovascular repair of aortic abdominal aneurysm. Why? If you have aneurysm, the major problem I should worry about after surgery is what? Not your lung sound, not your heart sound, it's your pulses. So that's what I'm worried about. And this is teaching a client with what? Chronic venous ulcer about self-management at home. Which of the following should the nurse include? Select or apply. What do you think? Number 1, avoid blood flow to your leg. Apply compression stocking to the leg after covering with the wound dressing. Apply odorless moisture to the leg. Elevate the leg and increase your vitamin C and protein and vitamin A and zinc. I can tell you, zinc, C, and A help with the skin. So even if you don't know, I'll pick them. That's the concept. Now, what is the problem in venous? Too much blood, elevated. What is the problem? Too much blood, compress it. What is the problem? We got to heal the skin. Moisturizer is good. And this is caring for 4 pediatric clients, 2 large pediatric patient. Prioritization, okay? Which client should the nurse assess first? 6 years old. He has coarctation of the aorta. His extremities, lower extremities pulses is weak. 4-year-old, he had Kawasaki disease. He has strawberry tongue. We have a 3-month-old with a VSD, with a pure poor weight gain. The tetralogy of Foley with cyanosis when crying. What do you think? What do you think? I would like to know. 84 questions. If you watching this, you've done yourself a good favor. Prioritization question. What do you think? All are expected finding, but which expected finding are bad? Coarctation, lower extremity, expected. Kawasaki is going to get strawberry tongue. VSD, poor weight gain, but this guy is hypoxic. Expected, but is the worst of all. Last question. 85 question. NCLEX practice question. Cardiology NCLEX practice question on concepts, pharmacology, EKG, interpretation, prioritization, everything about cardiology using select or apply, NCLEX select or apply questions, high yield fact, must know concept for NCLEX RN and NCLEX LPN. What do you think? Which client should the nurse assess first? Prioritization and delegation issue, right? 72-year-old with Afib. He has irregular pulses. He range 110 to 115. 65-year-old, he has heart failure with dyspnea at rest. 60-year-old, he has stable angina, right? And chest pain when he's walking. A 70-year-old, he had cabbage. He had chest pain 7 out of 10. Who should you worry about? If you have cabbage, you're going to have chest pain. You have stable angina, you're going to have chest pain when you walk. When you have heart failure and you have dyspnea at rest, problem. AFib, your heart rate is this, is that. Thank you very much. cardiology, NCLEX practice question, NCLEX review questions, NCLEX questions and answers for RN and RPN. Thank you for watching and have a good day. Good luck in your exams. If you need more, I'll put in the link, description about cardiology concept, NCLEX practice question, and subscribe to ADAPT NCLEX for more content like that. And share this video with your friends so that they can benefit from that. Good luck, best of luck, and bye.